Good evening and thank you for staying with us. Welcome to our COVID-19 special program. I'm Neota Igbe. Here are the highlights at this hour. The Nigerian Center for Disease Control asks states to increase sample collection as testing capacity reaches 10,000 in the country. Health workers in Nasarawa State begin a 7-day warning strike. And Americans fear surge in COVID-19 toll as the country's cases exceed 2 million. Nigeria currently has the capacity to test up to 10,000 samples per day. Unfortunately, only 1,000 to 2,000 samples are available daily for testing. The Director General of the Nigeria Center for Disease Control, Dr. Chikwe Hekwazu, is appealing to the state government to step up the sample collection process. Ms. Hekwazu said the NCDC may even test more samples if pushed hard to do so.
Our labs are working at 10 to 20% of capacity, right? So we have the capacity to test a lot more. We can test about 10,000 samples per day, probably more if we were pushed hard. So the labs are there. The samples are not coming as sufficiently as we want. So we really ask over this weekend, every state to push harder. We've been pushing with the state epidemiologists and the only way we can know whether we're on top of this is really by testing. And we are ready to do that. Gene Expert Labs locations will start functioning on the 14th of June. We've been working very hard over the past 2 weeks to distribute the cartridges to the first 7 centers to train them to make sure they're ready. So on the 14th of June, they start testing. So a lot of work has gone on to build the capacity of our labs, and that will continue until every state is able to test in their state. So the challenge now is we are challenging the states leading the contact tracing, leading the case identification, to bring in the samples so that we can collectively know how close we are to the peak.
And while schools have not been opened in the country, the Presidential Task Force on COVID-19 says it has not asked that learning be stopped. Today at the briefing in Abuja, the Minister of State for Education says the schools have been given permission to conduct online exams in line with the foreign curriculum that they operate.
Private schools that have that content, they are tailored really to satisfy the ability of some of the children of expats who live here, so that when they return to their countries, they'll be able to rejoin their own school system. That's why that's what their license included in the first place. I've heard stories that we have asked that they should not. What we said is what PTF has said. No movement, no return to classes. But we have not said people should stop learning. I'm encouraging everybody to try and learn. And if such schools are able to host online classes for the curriculum that they operate, and they choose to use the period to cover their syllabus, it is permitted from the exam body that they also ascribe to then conclude those schemes. It would not be proper for us to now say, wherever you are in your village or in your room or wherever your person is, you cannot issue him exams. It won't make any sense.
The Coalition of Health Workers Association in Nasarawa State has embarked on a 7-day warning strike. The Secretary of the State Chapter of the Nigeria Medical Association, Dr. Amos Tunde, told Channels Television today that they are demanding 5 things from the government. Top on their list is the domestication of the COVID-19 hazard allowance. They are also not happy with the increase in the number of health workers infected by the coronavirus at the moment, 26 of them in isolation, absence of promotion for over 10 years, and high taxation. Dr. Amos says that the association is conducting skeletal services at the isolation center in the state, but may be forced to withdraw their services if the government does not meet their demands. This is coming at the time when the number of confirmed cases of coronavirus has continued to increase in the state, standing at over 100. And in Niger State, the House of Assembly has summoned members of the State Task Force on COVID-19 to account on their stewardship, especially with regards to how much funds budgeted by the state government have been expended. Our correspondent, Empress Simon, has more on this and other stories from the state.
Days after Governor Abubakar Bello declared relaxation of lockdown in Niger State, the State Assembly decided to summon the Secretary to the State Government and Chairman Task Force on COVID-19, as well as the Commissioner of Health, to come and brief the legislators on how money budgeted by the state government for the fight against coronavirus has so far been expended.
We want to know, has there been any form of allowances that are being paid specifically to the committee in this regard, and to the health workers, how much have you done in making sure that they get their hazard allowances from the committee?
The 300 million that was first approved was to take care of these ambulances, issue of water tankers, and supply and buses movements, and some other forms of logistics. So in total, when we add the second palliative amount, 186 million, 15,000 naira, to the 300 million, that would give us about 486 million, 15,000 naira. Those are on the task force activities and other related issues. It does not involve the medicals.
The legislators also raised concern on how the task force will ensure adherence to the measures necessary to curb the spread of COVID-19 now that the lockdown in the state has been relaxed. But the chairman of the task force said going forward, rigorous awareness campaign will be carried out, especially at the rural areas. From the Niger State House of Assembly complex in Mina, Emperor Simon for COVID-19 update.
Well, that's from Niger State, where our correspondent Emperor Simon was looking at what the State Assembly is doing. But in Imo State, southeast Nigeria, apparently the State Assembly also had some conversation around the pandemic. Our correspondent Tokwe Kutei brings us an update on that situation that happened earlier. Tokwe?
Good evening. Owing to the increase in rape cases in Imo State, allegedly occasioned by the lockdown during this COVID-19 pandemic, the Imo State House of Assembly today moved a motion seeking to address the incessant rape cases in Imo State and calling the attention of the state government and urging the governor, Hope Uzodinma, to partner with the judiciary, traditional rulers, and most importantly, security agencies in ensuring that such cases are not concealed at the community level, and also recommend stiffer penalties for such offenders in accordance to the law.
While supporting the motion of urgent public importance, and also stating clearly that yes, there's a war against the people, maybe because of the situation we are all in. They said an idle man is the devil's workshop. It's possible that this has also become a very, very important factor that is causing the rise in the cases of rape. And our parliamentarians have also expended sufficient time to make provision for this crime called rape. Our criminal code, which is applicable and enforceable in all the states of southern Nigeria, makes ample and sufficient provisions for the crime of rape, including punishment that is adequate for rape.
This motion is urging our governor to step up and bring in the security agencies in the state, the police and all other security agencies, and also the chief judge of the state to come into play, while also telling the traditional rulers of the state to make sure that this issue of rape is not concealed under just the family and community levels. So people should speak up. And then let's have the traditional rulers and security agencies take up these issues seriously.
Having moved this motion, all eyes are now on the executive to, as a matter of urgency, look into these issues and take necessary actions to curb this ugly trend that is of the increase in Imo State. From Owerri, the Imo State capital, Eyitope Kuteyi, for COVID-19 updates.
Thank you, Tope, from over there. But you see, the matter of compliance to the directives of government has been on the front burner for a while now. The manner of people going around without wearing their face mask, no social distancing, traveling across state borders, when there's been that announcement over and over again about boundaries being closed. One wonders, when would the people, when would Nigerians, or when would those residents in the different parts of the country understand the importance of sticking to the guidelines? Joining me to discuss all of this is a public health consultant, a public health physician, Dr. Adekemi Kiladejo. Thank you for joining us.
It's good to be here once again. Thanks for having me.
Okay, so you had quite a journey coming in here.
Yeah, quite some. Yeah, quite a journey.
What did you see as regards compliance?
Wow. I would say there's still a lot that needs to be done with compliance. Compliance generally. Compliance to the use of face masks, compliance to social distancing. I mean, that's the worst of it. And then even the interstate travel bans. We still have a long way to go, definitely.
The matter of social distancing here, there are those who are concerned that it's more about how survival.
Yeah.
Someone will say, when you go into the markets, there's no social distancing. But the people in the market are trying to sell their goods.
Yeah.
So how do you balance the need to make money and the need for safety?
So, absolutely, you've made a very, very valid point. So we're talking about the balance between life and livelihood, the balance between health and wealth. Health in the sense of the COVID-19, wealth, you know, making ends meet. But you see, that balance is important. There is a tilt towards the livelihood, and people have thrown their health. Thrown caution to the winds concerning their health. And so you could see that people are beginning to act as though we had certified Nigeria COVID-19 free. Mm-hmm. It seems like the easing of the lockdown, or what the presidential task force announced, it seems like it was taken to mean that COVID-19 has been eradicated.
Are you implying that they shouldn't have eased the lockdown? Oh,
absolutely not. I believe they should have eased. I'm fully in support of the easing of the lockdown, but I'm talking about the perception of many. Many believe that COVID-19 doesn't exist. And that's what we're seeing. And so, you see, for you to follow guidelines, rules, regulations, it's very important for you to understand why. If you don't understand why, you see a lot of compromise. I will say that there is a lot of information going out there, but this information has still not caused behavioral change.
Why do you think the information going out is not causing the kind of change desired?
Well, there are a lot of factors to it. The factors could be individual factors. We all respond to changes in different ways. Another thing is that maybe some other fraction of the society they're living in denial. That's the word. And then another thing is, maybe some people haven't had close relatives or people that are so much in touch with them have the virus. So they think it's all a lie. But you see, the truth is people are dying every day from this same virus. The truth is people are getting infected every day. Societies are losing their loved ones. Families are losing their loved ones. And we need to be socially responsible for our own lives and for the lives of those that we meet every day. And for the lives of our loved ones. So we can't afford to throw caution to the air. And so one thing I won't stop saying is continue to put on your face masks when you're in public places. Ensure you do your best to maintain 2 meters distance from everyone you come across with. Make sure you maintain respiratory hygiene and hands hygiene. Wash your hands with soap and water. You don't need to buy 1 million naira soap. I mean, even the bars that cost 100 naira in the market, they have the contents to make your hands clean.
The bars they've gone up in price.
Yeah, but they might have gone up, but I mean, you don't have to have the most sophisticated one. So you still, whether there was COVID-19 or not, won't you wash your hands? When you go to the ladies or the gents, don't you wash your hands? Don't you bath in the morning? So you probably have the bath soap in your house, in your bathroom that you used to take your bath.
But this...
So you need to...
The non-pharmaceutical protocols here...
The
non-pharmaceutical protocols, like hand washing, wearing face masks. Let's look at the hand washing thing. It's like a constant. I mean, growing up, we're told to wash your hands as often as possible. At the period when we had the Ebola in 2014, everybody was like, we got used to washing hands. And Ebola passed and everybody threw caution to let that one go. And now we're back to that point again of wash your hands, wear face masks now. These are the added ones, wear face masks and social distancing. But let's move from there and look at this matter of travel bans.
Yeah.
You think it was right that the different state governments said we're locking our borders?
Absolutely. I think it was the right decision to have taken as at the time they took it. And you see, the virus doesn't have legs. It doesn't have hands. It doesn't move, except people move. Okay. So when you move, you have the ability to spread the virus if you've already contracted the virus. And so the reason for the restrictions is to restrict the spread of the disease.
But it looks as if it's not working. I mean, the governor of Bauchi talked about 12 or 19 cases in his state coming from another state.
Yeah, that's sad enough.
Several times, Enugu state government has talked about the cases we have here are cases coming from Lagos, from other parts of the country. That means that the travel ban's not working.
Yeah, so it's multifaceted.
Why do you think it's not working?
One is we have our responsibilities as citizens, and the government has its responsibilities. If we all play our parts effectively, then we'll have it work. Now, the first question is, there is a restriction ban. You're not an essential caregiver. You're not carrying essential goods, maybe foodstuffs. What are you doing along the interstate borders?
Just hold your thought at that point. We're going to come back, we'll pick it up.
All right, that's fine.
Just stay with us.
Yeah.
Thank you for staying with us. We still have Dr. Adekemi Kiladejo. Kiladejo, this matter, you were talking about the need for people to move, the responsibility of government and the responsibility of
Yes,
people.
absolutely. So we were talking about the interstate travel ban and why it's not effective, why we think it's not effective. I said it's multifaceted. I mean, it's both the responsibility of the people and the responsibility of the government. So for the people to keep to the guidelines and for the government to enforce. So there must be a leakage somewhere. Are the people doing the wrong things? Is the government enforcing appropriately? So we need to check what's going on.
But do we really have to be forced to do the right thing, or do we really need to do that? If we know that you don't need to travel, just keep the virus within one location, do you have to move at all?
You see, human beings are not that simple. We're a complex group of people. And apart from that, with the way we process information, I told you, differs. And it's not every information you absorb that leads to behavioral change. And so we respond to issues in different ways. So you will see people that even before the state governments, the governors said, let's put a ban on interstate travel, they would say they are not traveling. They're not waiting for laws. They're not waiting for guidelines. But for some people, if the law is not being enforced, they will always travel. So, you know, we need to understand human behavior. But one thing I keep telling everybody is keep doing the right things to keep yourself safe. Keep being safe.
Thank you.
Yeah.
A public health physician, Dr. Adekemi Kiladejo, thank you for sharing this.
Thank you for having me.
And now, with the confirmation of 409 new cases in the last 24 hours, Nigeria's total number of confirmed COVID-19 cases are approaching 14,000. That's according to the NCDC. 1,351 patients have been discharged across the country and 382 deaths recorded. Of the new cases, Lagos has 201, the FCT 85, Delta 22, Edo 16, Nasarawa, Borno and Kaduna have 14 each, Bauchi 10, Rivers 9, 5 each in Enugu and Kanu, 4 each in Ogun and Ondo State, and Bayelsa, Kebbi and Plateau have 2 cases each. Lagos State still has the highest number in the southwest with 6,266 cases. The FCT in the North Central has once again displaced Kano to emerge second highest with 1,097 cases, while Kano leads in the northwest with 1,025. Edo leads in the south-south with 478 cases. Borno tops in the northeast with 385. Ebonyi maintains 152 cases but leads in the southeast. Now, talking about what's happening in the state, let's go to Plateau State, where the government has lifted the lockdown in the state with modifications on directives as it relates to appearances at public places, markets, as well as wearing a face mask and other health directives for compliance. Now, we talked about the rate of compliance. Governor Simon Lalong, during a press conference on the Isa, warned that the failure to comply with the directives would attract stiff penalties, including the closure of markets, shops, hotels, while the owners of such facilities would be prosecuted. Maybe that would make the difference. But so far, Plateau has tested 2,032 persons for COVID-19. 130 cases have been confirmed. 3 have died. 26 persons are currently on admission and 99 have already been discharged.
Earlier imposed in the state from Sundays to Wednesday is hereby lifted until further notice. 2. The curfew imposed by the federal government from 10 p.m. to 6 a.m. will continue to be observed until further directives are issued. 3. There shall be no entry whatsoever into public offices, banks, markets, stores, tricycles, and vehicles without wearing face masks. Violators of this order will be arrested and taken before the mobile courts. Cultural festivals, anniversaries, and large-scale gatherings remain banned. Churches and mosques with large spaces shall be allowed to accommodate more than 50 worshippers under strict observance of the use of face masks, social distancing, hand washing, use of infrared thermometers, and the use of sanitizers.
Now, from the Plateau State, we hear this one. The FGF is talking on sporting activities. It says, I'm not excited about opening up for sporting activities. That's coming from the Secretary to the Government of the Federation. He says that knowing that sporting activities, particularly football, attracts large crowds in the country, the guidelines do not allow for such a gathering. But there are plans to resume the league within the next few days. How would that work?
Our guideline says that large gatherings are banned except, not to exceed 20 people except for places of work. I don't see the excitement that will be achieved if we allow sporting activities, particularly soccer like the Premier League, to resume in an empty stadium. A lot of the European countries where these games are big businesses have started looking at the prospect of returning to the pitches. But they are doing it in a deliberate and a very, very slow-paced manner. And most countries are saying that when they finally resume, it will be teams playing in empty stadia or stadiums. We will get there too. But for now, we are concerned with the few activities that we have allowed to resume. And we've given ourselves 1 month within which to do a thorough assessment and see how we fare.
Now, this matter of compliance at all levels in different parts, sporting activities, regular life, going to the markets, going to work or moving around, or even staying at home, the non-pharmaceutical processes of washing hands, mask wearing are some of the things I'll be discussing with former director in the Department of State Services, Mr. Mike Ejiofor, who joins us from our Abuja studio. Mr. Ejiofor, straight away, we'll start off with this conversation around the interstate borders that have been closed. Yet we continue to hear reports of cases being confirmed in state, and then those people have travel histories coming from different states. Why do you think that is so?
Well, thank you for having me. I must tell you that the restriction in interstate travel is very difficult to enforce because people have reasons to travel and move about. Since the order came in, people have been traveling, flattening the orders, and security agencies are not even helping matters because from the reports we are getting, the passenger buses and their cars go with their money, and at each point they pay like toll gates and pass such places. Some areas they also drop the passengers before the checkpoint, and they walk through the bush, and the driver will go and wait for them out in the next point. So there are ways which these measures are being manipulated or compromised. So it's very, very difficult to enforce, more so when you don't have sufficient manpower of the police or enforcement agents to man these points. So there continue to be movement, and the government should look for ways of modifying the restrictions. Otherwise, we're going to have problems. You see, you recall the first 2 weeks and 2 weeks that the government came in and they relaxed some of the measures. Otherwise, we would have had some serious crisis at hand. So they need to, the task force, the presidential task force, needs to look into ways of modifying these movements. But for instance, if you, even in Abuja here, it's difficult to enforce. They say carry 3-4 passengers with the driver. You still see people sitting 4 at the back and 3 in front in small cars. So if we are to face realities, I would suggest that they go a step further on movement and ensure that people are not only observe the protocols, but vehicles moving for whatever reason, except for families as directed by the presidential task force, should not be more than 4 persons in a car. And in buses, that is to create space. And wear their mask, the protocols should be observed. But complete lockdown or complete restriction of interstate movement is going to be very difficult, and people will not obey it.
But Mr. Ejiofor, you said something in your submission. You talked about people have the need to move. But is it an absolute need that can't wait? I mean, we have a pandemic on our shores. We hear cases every day. I mean, yesterday we had over 600 cases. Today we had over 400 cases. These are everyday people who are being tested and confirmed to have contracted the coronavirus. Some are dying. Yes, howbeit that there are many more recovering. Is that not enough for one to be cautious and say, okay, you know what, let me make a call instead of traveling? Some for some very flimsy reasons, as some will say, as I just want to see my family.
It depends on the level of people you are talking to. Nobody needs to tell me at my level now to sit at home or to observe the protocols. But there are people who have the need to. I'll give you an example. People are dying, and you have people who are bereaved. They must carry the corpses back. And you see, most of the mortuaries are being over-congested. So anybody who's bereaved will want to rush the corpses back home. So those are exceptional cases, if you agree with me. But there are some critical movements that have we stopped moving? That's the question. People have not stopped moving. No matter what you tell them, people will have need to travel. Don't also forget that the economy is biting real hard on people. Some are just out there to make a living. People who have trade, people who have to buy things and to sell, not agricultural products now that are the exceptions, you know. But I think the Presidential Task Force should again look inwards to see how some of this movement can be relaxed while not compromising the protocols.
Well, okay, on the roads we have the security operatives who are supposed to be checking to ensure that the numbers are complied with. Maybe 2 people at the back of the city, or at maximum 3 and 1 in front. But then it seemed people continue to get away with this by passing on a token here and there. Is it that the information has not reached the authorities so that those who are compromised are taken out of the spots where they are in order to ensure that lives are saved?
People are going to take out. Even within Abuja, it cannot be enforced. They don't also forget that this is a task force that is handling this issue of the pandemic. Many people still have to move, even within Abuja. If you cannot enforce such a sitting arrangement in cars within Abuja, think of outside. And coupled with that is that a lot of people also live in denial. They don't believe there is this COVID-19. And people will tell you it's political, it doesn't exist, government is using it because of their level of understanding. And that is why the government should further embark on enlightenment of the people to sensitize them and tell them that this is real. It is very real, and we were losing a lot of people. And at times, people will also tell you, you are talking about losing people to COVID-19. What about the people being killed by terrorists and all over? You know, so it's a major problem that is difficult to handle. And I believe that, my position is that the position should be relaxed while not compromising the protocols.
How would that, when you say relax while not compromising, what are the protocols you suggest?
Yeah, for interstate, for instance, people should be allowed to move, because if you continue to embark on the restriction, people are still traveling. We will not deny that fact. In your intro, you talk about Bauchi, people travel from other. How did they get there? Did they fly? They didn't fly. So it's easier to observe this restriction on international routes like airline or airports. But as long as people will continue to move between looking for source of livelihood, they will continue to move. And it's more difficult for regulations or measures put in place by government to be flattered by people without obeying the rules. So it's better we look for ways of modifying the regulations so that people can move. I agree that there's consequence for this action of allowing free movement at the borders, interstate movement. But I think we should, as a matter of urgency, look at ways. There's so much suffering. People are losing their jobs. People are going home. People cannot even cope in the cities are going home. I can't stop them from going home because there's nothing for them to do.
If you look at the period, if you look at the period before the lockdowns were eased, you notice that the numbers were not rising, and now the lockdowns eased, and the numbers are rising. And well, from the researchers say we might not see the impact of the eased lockdown now until maybe the next 2 weeks. So there's a likelihood that the numbers will continue to rise. So if we're going to say, let every restriction on movement be lifted, but let's modify the kind of restriction. So what would you suggest be done? In terms of, say, numbers in the vehicle, in a bus, how many people would you say should be there? How would you suggest that this be enforced?
Like take parks, for instance, motor parks, for instance. We have these thermometers that we use in checking people's temperature. Anybody who is boarding a vehicle and is found that his temperature is high should be disallowed from traveling and sent to isolation center or for further examination. And again, if you talk about like movement of vehicles, like I said, people have need to move. So it's important. You relax such measures. You look at enforcing wearing of masks, washing of hands at the park, provision of such facilities at the parks, and for people to move. But complete lockdown, it's of interstate movement. It's going to be very difficult to enforce. So I don't blame anybody. You are even creating money for some corrupt security officials because that's what they do now, to collect money and allow people to go. If you stop somebody, where will you take him to? Go back to where you're coming from, or put him in an isolation center or in a cell. So they have no choice than to compromise and allow them to continue moving.
So would you say that the curfew from 10 p.m. till about 4 a.m. should stay, but movements during the daytime should be allowed?
Exactly. I think the curfew should stay so that we'll be able to know what is happening, monitor exactly what is happening during the daytime. But the curfew should also should remain from 10 to 4 o'clock. I think I buy that idea that the curfew, because like it said, the COVID-19 or the pandemic doesn't move, it doesn't move around on its own. It moves around it's carried by people who move around. So we must also try and see how putting some measures to check, like in the parks, if you have people traveling with their families, you can allow them go. But when you see vehicles that are overloaded, they should be, in fact, I suggest they should have mobile courts in such borders so that the people are tried and convicted, like we had in Abuja here at the beginning of this pandemic. So some of the measures that I think that the government should adopt to check this pandemic.
Thank you very much, Mr. Mike Ejiofor. He's a former director in the Department of State Services. Thank you for sharing this evening with us.
Thank you for having me.
And we'll be back in a moment to look at what's going on in the rest of the world, United Arab Emirates and the rest of the world. Do stay with us. Thank you for staying with us. So 108 cases were recently confirmed in Ogun State, but the government has been clarifying on that figure, which is the highest figure in a single day to be recorded since the index case was announced on February 27, 2020. According to the State Commissioner for Health, Dr. Tomi Koka, 104 of those cases came from a company in Shagamu, attributing the spike to increased population sampling and the testing capacity that has been increased. While calling for calm amongst the people, she urged them to focus on the outcome of the cases which had been favorable for the state. More patients are being discharged, while 13 fatalities have been recorded, accounting for about 3% of the total confirmed cases. The Commissioner is assuring the people that the government will continue to remain vigilant and monitor the emerging trend while following best practices to execute appropriate measures to curb the pandemic. Indeed, governments at different levels and around the world are doing different things to ensure that everyone can get back to their life, their normal way of doing things, but yet there is the need to be precautious. In the United Arab Emirates, for instance, the government is planning to bring in about 200,000 of their residents that have been stranded abroad. The residents have been slowly returning to the Emirates since June the 1st on a series of special flights as the restrictions in place to stem the spread of the virus continue to be eased. And let's see what's happening around the rest of the world. A new poll by Axios Ipsos has found 1 in 10 Americans say they had an immediate family member or close friend who attended a protest within the past week. And they are fearing that this could result in a rise in the number of COVID-19 cases in the country. America remains the country with the highest figures of COVID-19 in the world, despite a reduction in the number of cases and deaths in Europe.
Today, the number of confirmed COVID-19 cases in the United States topped 2 million, climbing even above it, according to the Center for Systems Science and Engineering at Johns Hopkins University. The country's death toll also rose to nearly 113,000, with the hardest hit New York State reporting 30,680 deaths, according to the last count. German airline Lufthansa has said it will cut 22,000 jobs as it struggles to deal with the slump in air travel caused by the coronavirus pandemic. The carrier expects to have roughly 100 fewer aircrafts after the crisis and says half the job cuts will be in Germany. It hopes to agree the measures with unions by June 22. Germany is not alone as the coronavirus pandemic continues to take its toll on the UK economy, with 2 major employers announcing substantial job cuts. Up to 1,800 jobs are under threat at the McDonald's hotels chain, which has 31 properties across the UK. Deputy Chairman Gordon Fraser said there was no realistic prospect of returning to normal trading in the foreseeable future as the tourism and leisure industry continues to lobby for a greater easing of lockdown measures. In Latin America, 2 Brazilian state governors have been accused of corruption related to spending on medical equipment in the fight against COVID-19. In Rio de Janeiro, the Legislative Assembly voted to open impeachment proceedings against the governor, Wilson Witzel, for alleged corruption. In the northern state of Pará, federal police raided offices and the home of the governor, Helder Barbalho. Both governors deny any wrongdoing, and both have clashed with President Jair Bolsonaro over his handling of the pandemic and his opposition to introducing lockdowns. Brazil is the epicenter of the pandemic in Latin America, with more than 770,000 confirmed cases and nearly 40,000 fatalities. Over in India, the Health Ministry says data show that more people had been discharged than new infections recorded for the first time. India has recorded a total of 276,583 infections, the 5th highest number in the world. But with 8,102 deaths, it has relatively low fatality rate. In Africa, Kenya plans to discharge nearly all asymptomatic COVID-19 patients to free up space in congested hospitals. The government has released guidelines for home-based care for discharged patients, which include at least 10 days of isolation. Patients with no underlying health conditions and have suitable space at home are also eligible for discharge. The East African nation has confirmed over 3,000 coronavirus cases so far.
We'll get more figures about the coronavirus and the pandemic and the spread of it on our website, channelcb.com, with other top stories that we're following at this point in time, but also for figures around the infections in Nigeria. The Nigeria Center for Disease Control website is also there. They have the current figures and what's being done to ensure that this spread is contained. There's also, you'll find context there for the care lines that you can call to report a situation or report someone who's been infected so that they can come in and pick them up. Also check out the WHO website where the latest figures are also being shown there. You have about over 7 million that have been confirmed in cases and over 400,000 confirmed deaths in over 216 countries. That's what you find on the WHO website. You get all of this on this website. And that's our program for today. I want to thank you for watching. I'm Nell Taibe. Bye-bye.